Have I met you before? This is your first time of meeting me. Well, there's always a first time.
Putting a patient at ease is part of the job for Nigerian doctor Bosedi Afolabi.
I'm an obstetrician and a gynecologist, so I do both things. It looks like the baby is growing well.
This week on African Voices, a specialist practitioner dedicated to helping her pregnant patients by advancing the knowledge of the world's most common hereditary blood disorder, sickle cell anemia. Luth, more formally known as Lagos University Teaching Hospital. A busy institution in the middle of Africa's second largest city.
Good morning. Please come in and sit down.
Dr. Bosedi Afolabi spends a lot of time here, consulting, training,
Okay, including the notes. All right. Oh.
and researching. Her chosen field of study is sickle cell disease and how this affects pregnant women.
The women I see have sickle cell anemia, and they have a lot of problems in pregnancy. Would you like me to tell you about sickle cell anemia first of all? Okay, sickle cell anemia is this disorder of red blood cells. Okay, there's this hemoglobin, which is the major protein that's in red blood cells. And what happens with sickle cell anemia is that people with the condition, when they go through conditions of oxygen deprivation, or they're dehydrated, or they have infections and so on, the red blood cells turn into a sickled shape, which is why it's called sickle cell anemia. Now that sickled shape causes the blood vessels to get blocked, because the round shape, which is the normal shape of red blood cells, can navigate through blood vessels really nicely, but the sickled shape can't. So it plugs up those blood vessels, and there's a reduction of blood supply to the various organs. So once they have deprivation in oxygen or dehydration, or they're under a lot of stress, sometimes temperature if they're too cold, sometimes if they're too hot, the red blood cells do that. And so they start getting this crisis, which is because they are not getting enough blood supply to the different organs because they get blocked. So that's one of the problems they have.
Nigeria has the highest incidence of sickle cell anemia in the world. 1 in 4 Nigerians is touched by the disease, and virtually everyone in the country has lost a relative or a close friend to this debilitating blood disorder. Dr. Afolabi has spent years researching the effects of the disease on pregnant women. I asked her why this genetic disease was so prevalent in Nigeria, and was it true that it targets mainly people of color?
Not necessarily. Yeah. There is a large prevalence in people of color, African American people, but it is more around the Mediterranean areas as well. Now Nigeria, because we are so large in number, we have the highest number of people suffering with sickle cell disease in the world. Okay. Wow. Now, part of the reason sickle cell disease is thought to have come along is because of malaria, strangely enough. Because malaria is in those areas by the seas, basically, the tropical and the Mediterranean areas. And so the red blood cell thought, hang on, why don't I mutate so this malaria doesn't keep killing me?
Could getting pregnant be one of the reasons why it would go from a trait to the actual disease?
No.
Not at all.
What makes it the actual disease is inheritance. If somebody with a trait marries another person with a trait, there's a 1 in 4 chance that the offspring will have SS.
They do tests before people get married to see if
yes,
they're going to...
They try to do that a bit here as well, at least so that you can be informed. It doesn't mean you shouldn't get married, but at least know that you may have to find out if your child is going to have SS if both of you decide to go ahead.
Given the fact that you mentioned that Nigeria has the largest numbers, population-wise, of people with sickle cell disease, how many people are doing this kind of research that you're doing?
Well, there is this sickle cell center across the road now, where there's quite a lot of research going on in sickle cell disorder. But in pregnancy, very few people are doing research in pregnancy in SS women. very few. And the study I did, looking at all those things, the first that has ever been done, looking at all those things. And but in pregnancy, what people tend to do is to look at the clinical aspects, which is easier to look at. Okay, so how do the babies survive? Do they survive? Because there is an increased risk of maternal mortality in them, as well as perinatal, that is, the babies also die in pregnancy, either before they deliver or during delivery or soon after, or maybe they are premature as well. They have a really high risk of perinatal issues.
Once you figure out what is causing this, or what's the next step? To develop drugs, to take that research to a pharmaceutical company and say, look, this is a way to combat some of these issues, or what's sort of the end game, I guess?
You see, the thing about doing physiological research, which is what I'm doing, is that unfortunately it's not as dramatic as,
Eureka.
Exactly, I found it, but it adds a huge deal to the body of knowledge, but it is still possible that, on my track, I could find that, okay, so if this is deficient, we might be able to give this and, it will make things better. It's possible. But, more of what I'm doing is adding to the body of knowledge that exists and putting on some more things, especially since physiological research in pregnancy is not very common in them. It's strange because even the outside of here, in the States, you do have quite a number of African Americans with that get pregnant with sickle cell, but the research, even from there, is not that much at all.
That's amazing.
Yeah.
And is the life expectancy...
But in pregnancies, what
in
I'm
pregnancies,
talking about,
yeah. Right. Is the life expectancy for people with sickle cell disease still fairly low, in the mid-40s, early 50s?
Yes. Yeah, it is. But, about 40, 50 years ago, it wasn't even getting close.
Really?
And so a lot of them were not even getting pregnant. They weren't even getting to pregnancy. So things have changed
They couldn't get pregnant, or because
they couldn't live long enough to get pregnant.
Okay, right, yeah.
A lot of them died in childhood.
Okay.
Because people didn't know that much about the disease. There's this thing in culture, in all the different cultures in Nigeria, where you have some children in some families who just keep dying, and then they give them a particular name that they just die, and then some of them they tie something around their fingers to see if they will come back. The same person, because they feel they just die and come back, and come back.
Right.
But it's probably that these children had sickle cell disease. They have names in every language for them, In Yoruba is Abiku, in Igbo is Ogbanje, and in those times they probably just didn't realize that this is likely to be what these children have.
That's fascinating.
But the care is improving tremendously now, and a lot of children from research and hard work of doctors, and the parents also making sure that they give them good care. They're getting much better.